All right, stretch marks actually start off as something called stria rubra. They're pink, they're red, they're inflamed. You want to decrease that inflammation and hydrate the skin, improve that skin barrier. That's this phase. And then over time, they turn into stria alba, which is the white conventional stretch mark that we all have. And there's different treatments for this with the atrophic, which is that thin skin from the skin being stretched out. You want to stimulate collagen. You want to really help increase that cell turnover to help thicken that skin that has basically been thinned out. Okay, now let's talk about ways that you can prevent stretch marks, especially while you're pregnant, as these ingredients are safe during pregnancy, as we are very limited in what we can offer patients while they are pregnant. These are 3 ingredients that actually help prevent stretch marks, and I like this during pregnancy because they are pregnancy safe. Number 1 being scintilla. This is found in a lot of over-the-counter products such as Mederma stretch mark cream and Palmer's stretch mark cream. So just look that it has the scintilla in there, because sometimes Palmer's just has shea butter, which moisturization really doesn't do that much to help prevent. I think it's fine because it's massaging it in, but you really want to look for ingredients that are actually doing something. Number 2, almond oil. There's a really viral product here actually called Belly Oil, and it's by Hatch. And so this is a super cute bottle, but I was really glad to see that it actually had almond oil in it, because that is something that has been shown to help prevent stretch marks too. So if you are someone that's using that, rest assured it does do something. Okay, and number 3, hyaluronic acid, which we're familiar with for skincare on our face. So you can really use any brand. Neutrogena Hydro Boost has hyaluronic acid. Rock has a whole bunch of hyaluronic acid based products. You just want to make sure that if it is a thinner kind of serum, you do your serum first, and then your moisturizing cream, and then your oil last. Next is, why are we always moisturizing, or why are there so many moisturizing ingredients in pregnancy belly butters and things like that? Things like shea butter or like coconut oil, things like that. And the biggest thing is hydrated skin and moisturized skin is just healthier overall. And so it helps it in that early phase, that stria rubra that I was talking about, when they're like pink and violaceous. You do want to moisturize. You do want to really make sure the skin barrier isn't like open and dry and itchy and cracking. So that's why a lot of products out there just have moisturizing products. But again, my thing is, if you're gonna go in and you want to actually use ingredients, look for the scintilla, almond oil, or hyaluronic acid, especially while you're pregnant, since those are pregnancy safe. A lot of these will also have moisturizing ingredients in there. And then the fact that you're rubbing it in, increasing that circulation, that helps a little bit too. Okay, so you have stretch marks. They're white, they're older. What can you use over the counter? You know, retinols really help. Retinoid, as we know, we use it for the face. It stimulates collagen, increases that cell turnover. And then things that are kind of like exfoliants, so lactic acid, glycolic acid. So looking for ingredients that have a combination of those. I personally, if you're able to, would prefer a prescription strength tretinoin. So you would be using this after you give birth, or perhaps breastfeeding, whatever you're more comfortable with, because this has been really shown. A prescription strength retinoid such as tretinoin has been really shown to help decrease the appearance of stretch marks. Okay, the one treatment that works by far the best in my office for stretch marks is radio frequency microneedling. This is something like Morpheus. So when you think of an older stretch mark lesion, they're white, they're stretched out, the skin is essentially like thinner in that area. So what radio frequency microneedling does is it stimulates collagen, so it helps build up that tissue, but then also, and that's the deeper level, so 3.5, 4 millimeters deep, and then on that like 0.5 millimeter depth, so it's like resurfacing, it helps strengthen that skin, and it really helps just improve that skin quality, where typically that's how we would treat a scar. So in general, will it 100% make it go away? No, but it really helps tighten that skin, helps with that dermal process, and helps with the irregularity. If you are looking to do a treatment in an office, radiofrequency microneedling has been probably the best results and has been studied. If there's any follow-up questions, definitely reach out to me on Instagram. It's Derm Approved Podcast or Dr. Sheila Derm. And let me know if you guys want me to do a part 2 for season 2. I'll see you guys later.